Good morning. We are bringing you yet another insightful session of Apollo 24/7's Health Hour today. You must be knowing that chronic kidney patients have to visit a hospital setup very frequently, and while being on immunosuppressants, their immunity is so weak that they're vulnerable of catching COVID-19 severe symptoms very fast. So, how do we come out of this catch-22 situation? Let us talk more about kidney health in today's session, where our senior nephrologist Dr. Ravi Andrews is going to join us at 11 a.m. Be there and ask all your questions. See you there.
From the 1st of May, vaccinations are starting to be available in India to all people above the age of 18. The question that most people are asking is, which vaccine is more effective and which one should they take? To answer this question, let us first understand two terms: vaccine efficacy and real-world vaccine effectiveness. The efficacy of a vaccine is evaluated during a large-scale clinical trial. The trial is divided into two groups. Half the participants in the trial are administered the vaccine, while the other half get a placebo. Over the course of time, scientists calculate how many of the participants have contracted COVID-19 from both the placebo and the vaccine groups. If all the participants who tested positive for COVID-19 are in the placebo group, then a vaccine would have 100% efficacy. But if out of 10 positive cases, 9 test positive from the placebo group and 1 from the vaccine group, then the efficacy of the said vaccine will be 89%. Various factors determine the efficacy, like the duration of the vaccine trials or the different virus mutations in circulation at that time. There are 3 approved vaccines in India currently: Covishield, Covaxin, and Sputnik V. They are all based on different platforms but are fundamentally equivalent in that they help the body produce powerful antibodies and offer a similar safety profile. In clinical trials, Covishield has demonstrated an overall efficacy rate of around 70%. Covaxin has reported 78%, and Sputnik V has shown around 91% efficacy. The other way to measure how a vaccine is helping to control the pandemic is to analyze real-world effectiveness of vaccines, which looks at how the virus affects people who have already been vaccinated. On the 21st of April, the Indian Council for Medical Research said that a mere 2 to 4 people out of 10,000 who got vaccinated with either Covishield or Covaxin had contracted COVID-19. This number indicates how well the vaccines are working in preventing infections. But it is also important to note that the vaccine may not always prevent an infection. What it really does is minimize the risk of getting seriously infected and getting hospitalized. Real-world data of the Sputnik V is also impressive, suggesting that it is 97.6% effective against COVID-19. Another encouraging insight came from 2 studies conducted in India by the Institute of Genomics and Integrative Biology and the Center for Cellular and Molecular Biology. According to these organizations, both Covishield and Covaxin have shown positive results against the Indian double mutant variant, which is contributing to the current rate of infection. Preliminary results of the studies have revealed that vaccinated people who were infected with the double mutant strain were experiencing only mild illness. It is quite clear that vaccines are the most effective tool against the coronavirus, which will eventually end the pandemic. Therefore, it is important that all eligible people get vaccinated when it is their turn. All vaccines that are approved are effective and safe and will protect you and your loved ones from this dangerous pandemic.
It's always been there, standing between you and your health. A wall. Between a pain that won't disappear and a doctor who magically appears. Between a long wait on a hospital bench and staying right where you are, at home. Between finding yourself out of medicines and finding them at your doorstep, whatever the time. Between years of health records all over the place and all your records in one organized access from anywhere place. Between your current regimen and the recommended routine. The wall. We don't need it anymore. Say hello to Apollo 24/7. This is India's largest end-to-end omni-channel healthcare ecosystem, designed to touch more lives than ever before and delivering its promise in 3 important ways. 1. Listen. Talk to us anytime from anywhere. We've got 7,000 doctors and 30,000 healthcare professionals listening. 2. Advise. We'll give you expert advice you can rely on because it comes from India's #1 healthcare provider. 3. Assist. We bring you India's largest health network of pharmacies, clinics, hospitals and health insurance experts. 20 million people already trust us for their care, and a further 50,000 people are discovering this every day. Apollo 24/7. Expertise is for everyone.
Namaskar and welcome to Health Hour. Every week, we bring you an expert to answer your questions and queries, to give you important knowledge, and knowledge is power. Apollo 24/7 hosts the show Health Hour, and today we are going to talk about kidney care during COVID-19, which is a very, very important topic. Joining us very shortly is a senior consultant nephrologist from Apollo Hospitals Jubilee Hills, Hyderabad, Dr. Ravi Andrews, and we are going to take up your questions in the live show. Get ready with your questions. We shall answer them. And also, there's going to be a health quiz on the show. You can answer the questions and win prizes from Apollo 24/7. Also, wait till the end where I'm going to give away discount coupons as well. So let's start the show today by talking about vaccinations. I got vaccinated. My family is vaccinated. I hope you all are doing this because we have to do this for India. And we want to keep India safe. We want to keep India free from COVID. Then vaccination is the only way to take care. And Apollo 24/7 is rewarding us for doing this. It's a job that it's a responsibility, but if you have got vaccinated from any of the Apollo centers, then you can claim these rewards. Rewards for getting vaccinated with Apollo are free virtual consultations. You can get discounts. You can get cash back on medicines. You also can get free membership of Ghana and Lenskart as well. So do go ahead and get vaccinations from Apollo centers, and that's how we can keep our country safe. You can scan the QR code which is on the screen, or there's a link which is in the chat box of YouTube. You can click the link and then land at a page where you can book a slot for yourself from Apollo 24/7. So let's all get vaccinated. No one is safe till we are all safe. We are together in this. Let's do this. Let's start the show today. I'm waiting, eagerly waiting, in fact, for the star of the show, our expert nephrologist, Dr. Ravi V. Andrews, who's a senior consultant nephrologist at Apollo Hospitals Jubilee Hills, Hyderabad, who specializes in nephrology and internal medicine, who has more than 20 years of experience in nephrology and treating kidney-related ailments. He's one of the 3 nephrologists in India to perform a successful 3rd kidney transplant in the same recipient in 2012, and the first nephrologist in AP and Telangana to perform a swap kidney transplant in July 2014, and who is rated the best nephrologist in Hyderabad since January 2012 till date on an online portal, www.ratemds.com. And it's a privilege, honor of welcoming Dr. Ravi Andrews back onto the show. Namaste, Ravi Garu. Welcome to the show.
Namaste, Jansi, and thank you very much for giving me this opportunity and this platform to connect with our viewers. Welcome, viewers, to this new edition of Apollo 24/7 Health Hour.
Wonderful, doctor. It's always having you on the show is a great energy booster, and you give us so much of positivity. Thank you so much.
Thank
Yes,
you.
so there are already a lot of questions which have been asked on the registered platforms. I'm going to bounce them off to you, but to start off with, the entire pandemic, I know you've seen it really very close at your personal end. COVID is something that is affecting us at multiple platforms. But what is the impact on kidney that COVID has? What have you understood from this journey from last 1 year?
Yes. Now, there are two ways to look at this, Jhansi and viewers. One is the direct effect of COVID on the kidney, and the effect of people who have kidney disease and can get COVID. Now,
Right.
directly, COVID has been proven and has statistics have shown that at least 30 to 50% of patients who get COVID get some kind of kidney disease. Either their urine output drops, or they'll get protein or blood in the urine, or they get urine infections, or their creatinine increases. This is about 30 to 50%. And if
That's
you
a large
already have
number.
that's a large amount, yes. And if you already have kidney disease, the chances of the kidney disease worsening with COVID increases. Now, those patients who have kidney disease already, they are more vulnerable to more severe COVID infections. Not only are they more vulnerable to getting the infection because of their immunity, which is less, but also they are more vulnerable to getting more severe infections, more likelihood of going to the ICU, and more likelihood even of death. So patients with kidney disease have to be very, very careful about COVID. They have to make sure they follow all the routine precautions and also ensure that their basic kidney problem is well controlled.
So, understanding that CKD, chronic kidney diseases, are the worst affected, how should one take care? As you were mentioning, you have to take extra precautions. What are these extra steps that one has to take?
Yeah. The basic steps, Jansi, are just the SMS, which we all know for the last 1.5 years: social distancing, wearing masks, and sanitization and hand washing. Now, chronic kidney disease patients can be classified into three categories. One is those who are pre-dialysis. That means they're not on dialysis, but they do have some kind of kidney disease. If you want me to use the technical term, the creatinine is slightly more than 1.5, which is the normal range. The second category are those who are already on dialysis. These are what we call end-stage kidney disease, and these patients need to come to the hospital at least 3 times a week for dialysis. And the third category are the post-transplant patients, those who had a transplant. So they have a normal kidney function, but they're immunosuppressed and they're on medication. So the chances of getting infections are much higher. So now for all these three categories of patients, the routine SMS will follow. Plus, if you have plain chronic kidney disease without dialysis or transplant, you have to ensure that whatever kidney disease, the cause of the kidney disease you have, whether it's diabetes, blood pressure, stones, whatever, all that is under good control. Those who are on dialysis, there is a tendency to try and avoid coming to hospital because they feel that if they come to the hospital and get exposed to other patients with COVID, they're likely to get the infection themselves. There's a tendency to reduce the frequency of dialysis. Standard frequency of dialysis is 3 times a week, but these patients try to come 2 times or 1 time a week, which is an absolute no-no. It should never be done, because the last thing you want is, in the fear of COVID, get your kidney function worse or get into problems because you're being inadequately dialyzed. And if you're inadequately dialyzed, there's more chance that you will get hospitalized for that, and that could make you more vulnerable for COVID infections. So make sure that your dialysis procedure is going as scheduled, taking the usual precautions, avoiding crowds, avoiding people, masks, and all that. Those who are post-transplant, they should ensure that they're continuing their transplant medications. Don't try and reduce the immunosuppressants thinking that you will be able to protect yourself from COVID by reducing the immunosuppressants. Don't ever do that. Continue the same dosing, because if you reduce your immunosuppression, you're likely to have rejection. If you have rejection, you'll be back on dialysis, or you might even, your life would be at risk. So don't make any changes there. But the bottom line for everybody is get vaccinated. Everybody.
Right.
That's the blanket rule for everybody.
So my question is, there are so many people who fear vaccination, and especially, people think that I have a condition, so am I eligible to get vaccinated or not? Are people with CKD or people on dialysis, on after transplant, are they eligible to get vaccinated?
The question, when people raise this question of is it safe to get vaccinated, I have a counter question to them. Is it safe to get COVID? It's definitely, it is definitely more risky to get COVID. Now the vaccination will, there are very, very, very few instances of people having some reactions to the vaccination, but this is probably 1 in a million. But the chance of getting COVID in these patients who got kidney disease or transplant or on dialysis is much, 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 much higher. So definitely everybody should get vaccinated, whether you got dialysis, whether you got transplant, whether you got just mild kidney disease. It's a blanket recommendation to get vaccinated. There is no contraindication to the vaccine. And if you want to really look or search for a contraindication, is if you have an allergic to reaction to any of the components of the vaccine. Otherwise, there is no reason why you should not get vaccinated. Even people on blood thinners should get vaccinated. People who are immunosuppressed, post-transplant, HIV patients, those who are post-malignancy, chemotherapy patients, post-surgery, everybody should get vaccinated.
So my question here to continue the vaccination doubts are, do I need to consult my treating physician before I get vaccinated? Or is it okay to go anytime, especially the kidney issues?
Yes, definitely. It is always good to consult with your kidney doctor before you get the vaccination. The primary reason being, after the vaccination, you might get, for a day or two, you might get a little bit of fever or body aches and all that. And then you might need to take some medications for that. So your doctor will guide you regarding that. And also, if you have any fears about vaccination, he will allay those fears and tell you. Definitely, you should keep your physician in the loop, especially kidney patients. They have to let their consultant know whenever they're doing anything or making any change in the treatment, so that everybody is in the loop. And if there's any complications or problems, they can be dealt with. Definitely, please let your nephrologist know. But still ensure that you still think about getting the vaccine.
All right. So in a situation where somebody is with a kidney issue, going through dialysis, got their vaccination done, but yet the fear of COVID, which is lingering behind, to get to the hospital, will I catch COVID? Will that affect me? How do I come out of this cycle?
The vaccine, unfortunately, is not 100% effective. We all know that. But if you get the vaccine, the chance of getting COVID are less than 20%. If you don't get the vaccine, there's a 100% chance of getting COVID. So, I mean, if you look at statistically and look at percentage-wise, definitely there's less risk of getting the infection when you get the COVID vaccine. On top of that, if you get the infection after the vaccine, the intensity of the COVID infection will be much less. The chance of hospitalization will be much less. The chance of mortality or death will be much, 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 much less. In fact, I think there have hardly been any deaths for anybody who has got COVID after getting the vaccine. I think we can count them on the fingers. Whereas people who have died after COVID without taking the vaccine are so many, 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 many more. So no questions here. Get the vaccine, continue your baseline treatment, make sure your diet, your weight, your medications, your blood sugar, your blood pressure is under control, but please take the vaccine.
All right. So, Doctor, the other question is, understanding from your inputs is that chronic kidney disease or any other issues which are major are prone to severe COVID symptoms if they are not vaccinated. So, how and why does this COVID affect somebody who's having a comorbidity like kidney issue?
Yeah, any kidney dysfunction or any other dysfunction like diabetes or blood pressure makes you vulnerable to any infection. Forget about COVID infection. These people have got immunosuppression and they're likely to pick up whatever infection that they are exposed to more commonly than a normal person with normal immunity. Not only that, their basic physiology or their basic system is slightly compromised because of the underlying disease. So when you have kidney disease, you will definitely see, because the body, we talk of body as kidney, as brain, as heart and lung, but remember, it's all one body and there is always crosstalk between different organs. And whenever there is a dysfunction in one organ, even though it is a very minimal one, it will definitely have impact on other organs. So patients with kidney disease are vulnerable to lung infections or lung problems. Patients with kidney disease are vulnerable to getting higher blood pressures or uncontrolled blood sugars. So all these things will predispose you to more severe infections. So these comorbidities that we talk about usually go hand in glove. So you have a kidney disease, you're likely to have hypertension, you're likely to have some underlying lung disease or some minor lung problem, brain problem, heart problem, blood vessel problem. All these will reduce the whole organ power. I mean, I'm trying to make it as
Simplified.
non-medical as possible. So all the organs are slightly compromised. In fact, studies have shown, or people have found out, that getting kidney disease is equivalent to aging by 10 or 20 years. If you have chronic kidney disease, you can just add another 10 years to your life. So that itself compromises all your organ function and makes you vulnerable to any other complication. And we know COVID mainly causes complications in the gut, the lung, and the brain and the heart.
Right. So one question from my end before I dive into the chat box today is the infamous black fungus or the mucormycosis and its implications on kidneys.
There are two aspects about this black fungus or mucormycosis. One is the direct effect on the kidney, and two is the effect of the medications used to treat the black fungus. Now, the direct effect of mucor on the kidney is hardly existent. It's almost non-existent. We see very, very, very few cases of black fungus affecting the kidney directly. Most of the time, it affects the lung, the sinuses, and the brain. Now, the problem comes when you get mucormycosis and when you have to treat it. The ideal treatment for mucormycosis is a drug called amphotericin B, and this can cause kidney dysfunction and cause pretty severe kidney damage. Again, in amphotericin B, there are 2-3 categories. One which is the conventional one, which is more toxic to the kidneys, and there's something called liposomal amphotericin B, which is much, much, much more expensive, but much, much, much more safe for the kidney. So anybody who gets the black fungus infection should have an assessment of his kidney function. The dosing of the medications, which is amphotericin B, the dosing which is going to be given for the kidney should be adjusted according to his kidney function. And generally, the rule of thumb among us nephrologists is if the serum creatinine is more than 2, we withhold that particular dose of amphotericin B. Remember, it needs to be given for at least 6 weeks. So we'll have to monitor the creatinine virtually daily for those 6 weeks and adjust the dose accordingly. But direct effect of the black fungus on the kidney, no. But definite effect of treatment of black fungus on the kidney is described, and we have to be careful about it.
Right. So there's one more question from my end about transplant, but I will ask this question later. I want to start off with the chat box questions. Ali Haidarji पूछते हैं, being a kidney transplant patient, I have been infected with COVID last month and I have recovered. My doubts, if I have not taken any vaccine, will it affect again in future? He is worried about अगर COVID वापस आएगा कि नहीं आएगा अगर vaccine नहीं लेगा.
Yes, Mr. Haider, definitely if you're not been vaccinated, there is a likelihood that you will get COVID again. Second infections of COVID have been well described. So you must, to just answer your question in one line, yes, you must take the vaccine. Otherwise, you will get a second infection.
Yes, and in continuation with his question, he asked, which vaccine is good for a transplant patient? Any recommendation?
Yeah, there's nothing like any particular vaccine is good or better, or this is not like, a seeding in Wimbledon where you have to seed 1, 2, 3. It's not like that. And even in Wimbledon, you can never say which seed is going to win and who's going to finally win it. So the seedings really don't matter. The same thing with the vaccine. The seedings don't matter. Whatever it is doesn't matter. Just ensure that you get some vaccine. Whichever is available earliest, take it.
Right. So in continuation with my transplant issue and question, I'm asking, what are I know that surgeries, any surgery during this pandemic have been either avoided or being postponed. What's the status with transplantations which cannot stop? I understand there's a huge issue around there are too many things that need to be calculated, worked out before a transplant surgery is planned. So how are you managing, and what are the new guidelines for transplantation of kidney?
Yeah. Throughout this pandemic, right from the first wave and the second wave onwards, the decision about doing a transplant was left to the kidney specialist, because he is the person who can judge best how bad his patient is, how urgently he needs a transplant. Now, if a patient is doing very well on dialysis and we can postpone the transplant for a few months, then yes, go ahead. But it's a decision which the treating nephrologist only can take. Now,
Correct.
let's look at it from another angle. You are a kidney patient and you're on dialysis. You want to have a transplant. If you continue to do dialysis, there is a risk that you will get COVID, and COVID in a dialysis patient is very dangerous. If you decide that you will do a transplant and post transplant you get COVID, now if I had a toss up between these two, which one would I take? Would I take a post transplantation patient getting COVID versus a dialysis patient getting COVID? I would take the post transplant getting COVID, because he is more likely to get over the infection as long as we take care of the immunosuppression. Now, in case post transplant he gets COVID and then you need to reduce the immunosuppression, at the most he'll get back on dialysis.
Right.
That even if the transplant fails, but at least he's alive. But if a dialysis patient gets COVID, he's probably not going to survive. So it's a clear matter of life versus death. So if a transplant is urgently indicated, the COVID or no COVID, I think the treating nephrologist would still go for transplant. Now, again, transplant, there are two types of transplants: cadaver transplants and live related transplants. Cadaver transplant is always an emergency, so there's no question there. If you're with the COVID, no COVID time, whatever, if you get a cadaver kidney, you should go ahead and get the transplant done. If it's a live related, that's when the decision comes, depending on the clinical condition of the patient. And obviously, if you decide to do the transplant, you will have to take all the precautions to prevent COVID infections. If ideally, in an ideal world, the patient would have already been vaccinated. In a non-ideal world, if he's not been vaccinated, make sure the donor and the recipient are checked for COVID. Admit them maybe a week or two before itself and isolate them totally, so that there's less chance of them picking up the infection. And post transplant, be very careful about SMS and all the other routine care.
Right. So next question is from Dr. Anil Kumar Sharma. He says he's a 65-year-old and he had partial nephrectomy in 2017. I'm taking my medicines regularly of hypertension and diabetes along with kidney, and I have both doses of vaccine. What are the other precautions that I should follow?
Yeah, I think Dr. Sharma, you're doing absolutely well. You've taken the vaccine, you're controlling your diabetes and blood sugar. Make sure you don't go out too much. Make sure you socially distance yourself from people. Make sure your nutrition is all right. Don't try and restrict diet in an attempt to protect yourself. Eat as normally and as well as you can. Make sure you exercise regularly, and don't try all these supplements and all which people are suggesting. Over the last few months, people have been suggesting all sorts of vitamin C, vitamin D. None of them really help. We have found out over the last 15 months that these things don't really help. So routine precautions: eat normally, keep your sugars, blood pressure, weight under control, and vaccinate. You've done absolutely the right thing. Please continue doing whatever you're doing and keep monitoring your creatinine and kidney function as you usually do.
Done.
Now,
Wonderful.
sorry, just one more addition there.
Yeah,
Sorry. We have this wonderful platform of Apollo 24/7. Dr. Sharma, you can always connect with your doctor on this platform. You don't even need to go to the hospital. So that itself will reduce your chances of getting the infection. You can also connect with your patients if you want through online platforms.
Done. Wonderful, doctor. Venkat Nareshi पूछते हैं, I've done my kidney transplant in 2017 and continued my medication. My question is that do I have to continue the medications for lifetime?
Yes, sir. Post-transplant, your body will always try and reject the transplant kidney. So you will have to continue the medications lifelong. But over a period of time, when your body starts attaining what we nephrologists call tolerance. When they start attaining tolerance to the transplanted kidney, there is a possibility that your dosing of immunosuppression will reduce. One point I want to make here, always the worry is, if a transplant patient gets COVID, what do we do about the immunosuppression? The answer here is, the recommendation all over the world is to reduce some immunosuppression. The drug that normally we stop is something called mycophenolate, and I'm sure all transplant patients are aware of that. So, of this particular drug, so mycophenolate will have to be stopped. The dose of steroid will have to be increased. The dose of tacrolimus will continue as it was. Of course, we will have to check the levels and adjust the dose depending on the levels. So that's what we do with the immunosuppression medicines. And as you are a transplant patient, I'm sure you're very, very, very well versed with these medications. So right now, no change in immunosuppressants, COVID time or no non-COVID time. Over a period of time, as your body develops tolerance, you might be able to reduce the dose of the immunosuppressants.
All right. Mr. Suresh Agarwal's question. I'm having one kidney now, that's nephrectomy, I suppose. Another was operated in 1968, and thereafter it was taken out in the year 1996. Since last week, I'm feeling swelling in leg and hand. Please suggest, does he have to monitor kidneys?
Yes, definitely, because you have one kidney, so you're more vulnerable to getting some injury to the remaining kidney. And if you're having swelling of the feet and hands, you definitely need to check your kidney function. I would suggest you do a routine kidney function test that includes creatinine, hemoglobin, urine test, and electrolytes, and see your nephrologist, and then he will be able to guide you. But congratulations, from 1968 onwards, you've been surviving on one kidney. That's very well done, and kudos to your nephrologist who's been taking care of you.
Wonderful, doctor. Mr. Ayyam Perumal's question. I'm 66-year-old. Creatinine level is 2. Urine flow drop by drop. So I take medicine for PB. That's it, doctor.
Now, from your...
I can ask him to type the question. Any other details that you require?
That's fine. I mean, Mr. Perumal, you're 66 and you have urine, which is, there is hesitancy in passing urine. Obviously, you have a prostate problem, and we can prove that by doing an ultrasound of the kidneys along with the post-void residue. So what we do here is we make you have a full bladder, take an ultrasound, see how much urine is there in the bladder, then you pass urine the ultrasound and see how much is staying behind. If it's a significant amount, which is for males more than 20 cc, then you have a prostate problem, and you can take medications to reduce that. If the medications don't work, we give a 1 to 3 month trial with medications. If they don't work and your urinary symptoms don't reduce, then you will have to have a minor surgery. The other thing you need to rule out at 66 is a urinary infection, which could cause these kind of symptoms. So for that, you will have to do a routine urine test and a CBP to look at your WBC count and see if there's any evidence of infection.
All right. Next question is, does diabetic medicine increase serum creatinine levels? Srinivas Rao is asking this question.
Yes, Mr. Srinivas Rao, diabetic medicines by themselves do not increase serum creatinine, though there is one tablet called metformin, which is not supposed to be given when the creatinine crosses a certain value, but not that it increases the creatinine level, but it can cause a complication called lactic acidosis. Otherwise, directly, most diabetic medicines do not cause kidney dysfunction. But if you have kidney dysfunction, the diabetic medicines that you take, the tablets, will act for a longer time, and there is a chance that you can get episodes of low blood sugars or hypoglycemia. So you will have to monitor your blood sugars more regularly if you have kidney disease and are taking diabetic medications. Ideally, for patients with advanced kidney disease, tablets are not a good solution. Insulin is a better solution because it's short acting, it will reduce your sugars quickly, and if your sugars drop down, it can also increase quickly.
Right. This is a 45-year-old's question, Mr. Kiran Rai. I have one kidney from birth. What are the precautions that I need to take care right now? COVID precautions.
Patients with yes, Mr. Rai. Many people are born with one kidney, and it is incidentally detected when they have some health check or some scan for whatever reason. So really it is not going to negatively impact your life in any significant way. But you have to take certain precautions, which I think anybody, even if they have two kidneys, will have to take. So ensure that you don't dehydrate yourself. So drink enough amount of liquids. Don't take too much salt and sugar. Keep your weight under control. Don't take unnecessary painkillers. So we take a lot of over-the-counter medications. If you have some pain, we take some Hyphenac or we take Vovaran or whatever. Avoid taking painkillers unnecessarily. If you need a painkiller, paracetamol is the safest. And avoid taking unnecessary antibiotics, because many a time when we have some cough, cold, fever, we just go to the chemist and get some antibiotics. So avoid all these, because ultimately most medicines come out through the kidney. And remember, you have only one kidney, so the way your kidney processes the medications will be different from those with two kidneys. So routine general precautions, otherwise you really don't need to worry. Remember the famous Anju Bobby George, who won a gold medal or a silver medal in long jump. So in the world championships, she was born with one kidney, and she managed to become a high-end elite athlete with one kidney. So keep that as your inspiration, and don't worry. Just take care of the routine things, and you will be fine. And of course, monitor your kidney function at least once in 6 months, so that you know in which direction you're going.
Right. Next question I would want to ask is Mr. Shikhar, who has asked in Hindi, typed in Hindi. Hello sir, मेरी age 27 है और मेरा creatinine 3.13 है और यूरिन नॉर्मल फ्लो में हो रहा है, सब अभी तो नॉर्मल है, कैसे कम करूं क्रिएटिन को और मैं नॉर्मल लाइफ जी पाऊंगा? प्लीज हेल्प मी, कैसे मैं नॉर्मल लाइफ जी पाऊंगा?
शेखर जी, एक तो क्रिएटिनिन 3.1 तो नॉर्मल नहीं है, लेकिन एक चीज मुझे पूछना है कि ये जो 3.1 है ये अभी से शुरू हुआ कि पहले से है? क्योंकि अगर 3 महीने से पहले अगर आपका क्रिएटिनिन नॉर्मल था, इसका मतलब है ये कोई नया प्रॉब्लम है, तो वो किडनी बायोप्सी करके हम पता लगा सकते हैं कि क्या कारण से किडनी का प्रॉब्लम शुरू हुआ और उसका इलाज भी ढूंढ सकते हैं। अगर 3 महीने से ज्यादा क्रिएटिनिन 3.1 है, 3.1 से ज्यादा है फॉर मोर देन 3 मंथ्स, फिर आपको जस्ट सपोर्टिव केयर करना है, ब्लड प्रेशर कंट्रोल, वेट कंट्रोल, डाइट कंट्रोल, और एवरी 2 to 3 मंथ्स आपको क्रिएटिनिन चेक करना है। और ये इसको क्रॉनिक किडनी डिजीज कहा जाता है, और जितना भी करो क्रॉनिक किडनी डिजीज बढ़ते जाएगा, क्रिएटिनिन आस्ते आस्ते बढ़ेगा, उसका बढ़ने का गति सिर्फ हम स्लो कर सकते हैं। सो ये आपको पहले डिसाइड करना है कि 3 महीने पहले आपका क्रिएटिनिन कैसे था। अगर 3 महीने पहले का रिपोर्ट्स नहीं है, अल्ट्रासाउंड स्कैन करके अगर किडनी साइज नॉर्मल है तो किडनी बायोप्सी करना है, फिर पता चलेगा एग्जैक्टली सिचुएशन क्या है। इसके लिए आपको नेफ्रोलॉजिस्ट से कनेक्ट करना है, ये प्लेटफॉर्म पे डिस्कशन पॉसिबल नहीं है।
Right. So yes, as you said right before this question, there are experts available on 24/7. You can consult any of them, Mr. Shikhar. So this is Mr. Kanyappan's question. I am 49, got transplanted 14 years back. I got infected with CMV 2 months back, and I am taking Valocon 450 for 1.5 months now. Can I take vaccine now or after the CMV infection is cleared?
Just how long ago did he get CMV? I'm sorry, I missed that. Jansi,
2 months.
did he mention that? 2 months back. Yeah, you can go ahead. Yes. So the CMV treatment is probably already completed, because if you're taking just one tablet of 450 of Valcon, then it's unlikely that you have an active CMV infection right now. What you could do is do something called a CMV PCR that will tell you if the infection is active. If the CMV PCR is negative, then it means that the infection is inactive and you can go ahead with the vaccine. If the CMV infection is still active, you need to treat that and make sure it is inactive before you take the vaccine. So CMV PCR test, you can do a quantitative test, will help you decide whether you should take the vaccine or not.
Right. So Mr. Nandakumar is asking this question. What are the effects of COVID on a polycystic kidney disease patient?
Polycystic kidney disease again depends on what the level of the creatinine is. If the creatinine is normal, then it's just like anybody else, any other normal person. But if the creatinine is elevated or blood pressure is not well controlled, or you have any other comorbidities like diabetes, then definitely the impact of COVID will be higher on you. And also it will be higher on the kidney, because we know 30 to 50% of patients with COVID can get kidney dysfunction. So again, the bottom line, take the vaccine. That will protect you. And monitor your creatinine on a regular basis,
Okay.
so that the polycystic kidney
So next
disease
question
taken
is
care of.
from Mr. Puneet Kshatriya, CKD diagnosed in 2004. Serum creatinine around 2. For the last 6 months, my weight has gone down from 70 kilos to 70, gone up from 70 kgs to 75 kilos. 64-year-old male. Please guide me for treatment and weight reduction ke liye, what are the ways?
Yeah, Puneet, unfortunately, this platform is not the one we can use to individualize or suggest individual treatment. But yes, weight gain in somebody who has got kidney dysfunction is something which needs to be investigated further. We need to decide whether the weight gain is because of increased diet or whether it's because of fluid retention. So if you have any swelling in the feet or on the face, then it's likely to be because of the underlying kidney disease which has got worse, and your diet is not under appropriate control. So I would suggest that you get in touch with a nephrologist either online or physically, and let them evaluate you. Don't ignore this, because sudden weight gain is something which is of concern and needs to be addressed.
Right. So there was a question about diet. Anyway, kidneys and diet are very closely, kidney disease and diet are closely related. So here's my question, Naren. Okay, yeah. But the question was his creatinine is slightly high and CKD is high. Okay, I got it back. Dialysis twice a week, approximately 2.5 years, since 2.5 years, and age is 56-year-old. Potassium is around 7. How do I get my potassium back into control? I don't eat any fruit or dry fruit. Please advise.
The very fact, the first sentence which I heard in the question was dialysis 2 times a week, sir. So dialysis 2 times a week is inadequate. Ideal dialysis is at least 10 to 12 hours per week. So we're talking about 3 times a week. The reason your potassium is 7 is because you're being inadequately dialyzed. You must switch to 3 times a week dialysis. Now, as far as the diet is concerned, I'm sure you're taking the required care. Another question which I have is, certain medications can also cause the potassium to go up. The common ones being something called telmisartan and some painkillers. So if you're on any of these medications, either telmisartan or olmesartan, what we call ARBs or ACE inhibitors, you will have to stop them. And if you're on any painkillers like Vovaran or Hyphenac, you'll have to stop them. But the definitive suggestion to you is to increase the dialysis to 3 times a week. Definitely your potassium will come down then.
All right. Next question is Mr. Palani Vale. My son is diagnosed with Wilson disease at the age of 15, having liver cirrhosis. Can he take the vaccination?
Yeah, I'm a nephrologist, so Wilson's usually affects the liver, but of course there are some people who can get kidney dysfunction also because of Wilson's. Now, the one thing that will decide whether you can take the vaccine or not is something called a prothrombin time. Anybody with liver dysfunction can have a prolonged prothrombin time, and this can predispose your child to bleeding after taking the vaccine. But again, there are a lot of guidelines which have come up now, and if your prothrombin time and INR is more than 3, then we should hold the vaccine for some time till that is corrected. Once it is below 3, then the vaccine can definitely be given. But of course, the person who is giving the vaccine should be instructed to use the thinnest possible needle, and pressure should be applied on the injection site for at least 10 to 15 minutes after the vaccine. And they should make sure that there is no blood clot after the vaccine is being given. So they should be observed for at least 30 minutes to 45 minutes in the vaccination center. And even at home, keep checking that there is no blood clot there at the site of the vaccination. But definitely, if the INR is less than 3, you should go ahead with the vaccine.
Wonderful, doctor. Thank you so much for taking that up. Next question is from Lalita. What are the precautions to prevent a COVID infection at the dialysis center? one. And two, she continues to ask about, she faces, after 1 or 2 hours of dialysis running, my body is cold and shivering. And while, that's it, yes. These are the two questions that she's asked.
Yeah, the precautions that you have to take are really the usual ones of social distancing and masking and hand sanitization. Most dialysis centers anyway take the standard precautions of wearing PPE whenever, all the staff there will be wearing that, and they will be using all the universal precautions. So, and of course, vaccination. These are the ways you can use to prevent COVID infections. And again, like I want to emphasize here, ensure that you do not cut short a dialysis session and you do not miss dialysis sessions for fear of COVID. And if you have any fever or cough or any symptoms suggestive of COVID, get the COVID test done. And if you're positive, then they can dialyze you in a separate area, which is specially designated for COVID patients. So no special precautions. The dialysis unit that you're at will be taking all those precautions. As far as your discomfort during the dialysis after 1 or 2 hours, possibly the amount of fluid removal is more during the dialysis. That's the reason why you're feeling cold and shivery. So if your BP is dropping at that same time, then you will have to ensure that you don't gain too much weight between two dialysis sessions. Because what happens is, if you gain too much weight, then the dialysis unit will try and remove more fluid from your body in that whatever 3 hours or 4 hours that you're there. And in that process, you might lose a lot of weight, your blood pressure might drop, and you might feel cold and shivery. The other reason for feeling cold and shivery during dialysis is if there is some low-grade infection in the body. So your particular doctor will be able to evaluate you for that and check for that. So these are the two possibilities. Either too much fluid is being removed because of excess weight gain between two dialysis, or you have some low-grade infection. The people in the dialysis unit will take care of it.
Next question is from Sri Parna Sarkar. What is the lifespan of a patient who undergoes dialysis 3 times of a week? And her continuation is, uncle's creatinine level is 8.5 and his echo shows ejection rate value as 32. In the last 14 days, he has undergone dialysis where almost 24 liters of water is removed. Suggestions for him.
Okay, now the first part of your question is the lifespan of people on dialysis. I can tell you statistics, because individual lifespan nobody on this earth can tell you. Statistically, at the end of 1 year of dialysis 3 times a week, 10% of people die, 90% are okay. At the end of 5 years, 50% die, 50% are still alive. And at the end of 10 years, 90% are dead, and only 10% of people on dialysis are still alive. But these are all statistics. Individual, we have had dialysis patients who've been having dialysis for the last 20 years, and they're doing dialysis and they're so comfortable with dialysis, they don't even want a transplant. So individual patients are different. Now, as far as your uncle is concerned, at his age, and he has got a very poor ejection fraction of 32%, the outcomes are not going to be very good for him. One suggestion for him is, if he's having trouble during the hemodialysis, there is an option to do something called peritoneal dialysis. This can be done at home, and people will train you how to do it, and then somebody, the patient himself or a family member, can do it at home. The advantage of peritoneal dialysis in patients who've got poor ejection fraction is the blood pressure fluctuations will be minimized and the load on the heart will reduce. So think about this one option for your uncle. Otherwise, the approach was right, because obviously he had a lot of fluid and 24 liters were removed over the last 14 days, and he must be feeling better after the fluid removal. But with a poor ejection fraction, there is a likelihood that he might have more complications of hemodialysis. So consider peritoneal dialysis.
Okay. Doctor, there are 3 questions where people have asked if the levels are fine and if they're in control. There are 3 various issues that they're asking. Let me ask all the 3 questions because I'm running short of time. Vishwanathan Sridharan, BUN, blood urea nitrogen is 25 and the ratio of creatinine to BUN is 18.8. Is that normal? And second thing is Madhu Ganesh, serum creatinine 1.4, then protein trace RBC nil, pus cell 6.8. Is there a problem? And one more was there. All right, is creatinine 1.5 above 1.5 normal? Ultrasound is fine. So people would want to know what is a normal kidney function.
We do something called a serum creatinine, and different labs have got different normal values. In Apollo Hospital, the normal range for males is zero point 0.8 to 1.3, and for females, it's 0.5 to 1. So, any creatinine which is above the level of the lab in that particular range, that is abnormal, and anything which is abnormal needs to be investigated. So, there are the methods of investigations are non-invasive and invasive. The non-invasive methods would be urine testing, ultrasounds, and blood testing, whereas the invasive methods will be kidney biopsy. And people have this misconception that biopsy means cancer. No, biopsy. Fortunately, we have two kidneys, so there's a possibility to biopsy one of them and understand what the cause of the kidney dysfunction is. So all these people who have reported these slightly elevated levels in creatinine will need evaluation by a nephrologist, and to be scientifically sure, and the gold standard test to understand the kidney function and the cause of dysfunction is to do a kidney biopsy. And the gentleman who told the reports of the BUN slightly higher, he yes has a slightly higher BUN, but then the serum creatinine is probably a better indication of kidney function, though it's not the best. It's a better indication than doing a BUN, because a lot of other reasons can cause the BUN to go up. So he will have to do a serum creatinine, and if that is abnormal, get in touch with a nephrologist so that they can work on this further. Do not ignore a slightly elevated creatinine, because it might lead to more problems in the future. So don't take it lightly. If the creatinine is even slightly higher than the normal range, please see a kidney specialist.
All right. Next question I would like to put to you is Ms. Jyoti's, who's a lupus nephritis class 4 and a female 40. Visoline 7.5 mg daily. Can I get a vaccine done, and any preference of vaccination?
I think we have already answered this question 2-3 times. Yes, Jyoti Garu, you must have a vaccine done, and 7.5 mg of Visoline is a very small dose, so don't worry about it. Please go ahead and get the vaccine.
Right. So a lot of questions about vaccinations. I think reiteration at any number of level is fine. Next question I would like to put to you is, yes, he was affected. A lot of people, let me bundle this question. People have gone through COVID and they find that their creatine level has come up. Is this normal? Will it come down on its own, or will their kidneys have to be monitored? If yes, how long?
Definitely yes, because COVID is known to increase the creatinine and cause kidney dysfunction. So this is expected in 30 to 50% of patients who get COVID, that they will have a rise in the creatinine. If the creatinine was normal or the kidney function was normal before COVID, there's a very high chance that it will come back to normal over a period of 3 to 6 months. If the kidney function was already abnormal before COVID and it's gone up further, then that also there's a possibility that the kidney function will recover over a period of time. What my suggestion would be, if your creatinine has increased post-COVID, if it does not reduce, you will need to monitor the creatinine, of course, at least on a once in 15 day or once in a month basis. If it doesn't reduce at the end of 2 or 3 months, then you should think about doing a kidney biopsy.
Right. And here's somebody who's already had a IgA nephropathy, and 42-year-old Karthik. He says after COVID infection, creatinine came down from 6.3 to 4.4. That's after medication. Will the creatinine go back to normal if I continue medicines?
Yes, Karthik, I think I know you. We have already had a discussion on this, but for the benefit of the viewers, Karthik, I think you already have a chronic kidney disease, which by definition does not recover. But probably after COVID, you had a rise in the creatinine, and with that, the creatinine went up to 6. Now, after you got over COVID, it's 3 months, I think, since you got over the COVID. Now the creatinine has come down to 4.4. This is also because of other medications which have been given to treat the IgA nephropathy. And this is one thing I would like to share with the viewers as well. There are some newer drugs which have now come out and been US FDA approved for the treatment of IgA nephropathy, which slows down the progression and is found to be useful. So your nephrologist will be able to help you regarding that. And as far as Karthik is concerned, let's wait and see. There is a possibility, because we don't know your baseline creatinine. There is a possibility your creatinine might come down to below 4.4 also, but only time will tell. In the meantime, you have to control your blood sugars, you have to control your diet, and of course, control your weight, which I know you're doing. All the best, Karthik.
Thank you so much. All right. Ashutosh Gupta ji's mother is 48-year-old. Protein leaking in urine. Creatinine is okay. Currently, medication, we're consulting on Apollo 24/7 online platform since 2 months. Should I continue the online consult, or when do I understand that I need to take her to a physical consult?
The protein leakage has to be quantified. So if it is more than 2 grams per day, and there's a method to quantify it. There's a spot test that you can do, which will direct us and tell us how much the protein leakage is. If it is more than 2 grams, then it's better that you go for a physical consult and get a biopsy done to understand the cause of the protein leakage. If it is less than 2 grams, you can just continue with medical treatment, monitor the creatinine very closely, and you can do it online.
Right. Mr. Kaleem is asking, is a CKD patient, creatinine is 6. If HB become normal, does that mean that kidney is working properly? I don't understand the question, doctor. I hope you got it.
Yeah, I understood it, Jansi. So normally we see when the creatinine is more than 5 or 6, the hemoglobin generally drops. There are few situations which are exceptions to the rule. One of them is somebody with polycystic kidney disease. There you can still have a high hemoglobin in spite of having a high creatinine. Otherwise, most of the kidney diseases with high creatinine will be associated with a low hemoglobin. Now, I'm not sure if Mr. Kaleem is taking any medications to increase the hemoglobin, because there are some injections called erythropoietin, which are given to patients who have got a high creatinine in an attempt to increase the hemoglobin. So if he is already on that injection, that's the reason why the hemoglobin is normal, and he should continue it. But of course, make sure the hemoglobin doesn't go too high, because if it goes too high, that means more than 12, he can get strokes or he can get high blood pressure. So if he's already on the injection, monitor the hemoglobin, decide the dose depending on the hemoglobin. If he's not on the injection and his hemoglobin is high in spite of having a high creatinine, then very good for him, lucky you. And let's hope it stays that way.
Good. So this question is froth in urine. Dheeraj Sharma ji. Last 6 months से urine में froth है. All reports, urine, everything are normal though. Should I worry?
Yeah, Sharma ji, if the urine reports are normal and just appearance of froth in the urine से कोई डरने की कोई बात नहीं है. बट एक दो बार आप रिपीट कीजिए. मेनली यूरिन में प्रोटीन आएगा तो यूरिन में फ्रॉथ आता है, तो फिर आप एक दो बार यूरिन प्रोटीन टेस्टिंग कीजिए. The testing you can do is something called a 24-hour urine protein, a urine spot protein, urine spot creatinine ratio, and a complete urine examination. ये टेस्ट करेंगे तो 100% पता चलेगा कि आपका froth is because of protein or something which you don't need to worry about.
Okay, so last 2 questions that I would quickly want to put as one. Sai Kumar's question: mother is 54, cervical cancer, to be examined about for chemo. Already a PKD infected, creatinine reduced to 4.6. Should I go for vaccination now?
I think first we have to evaluate her from the cervical cancer perspective and make sure the chemotherapy is appropriately given. If all that is done, then you get a green signal from your oncologist. From a kidney perspective, creatinine 4.6 is never a contraindication for the vaccine. You can go ahead with it, but just confirm with the oncologist or the cancer specialist whether it can be given. From a kidney side, no problem with the vaccination.
All right. And the last question would be about UTI post-COVID recovery. There are 3 people who have asked. I don't want to take individual names. Along with Ms. Meenu Arora's question, whose urinary infection has Klebsiella pneumonia and sensitivity to nephrotoxic drugs. So can we address UTI post-COVID?
Definitely, any disease apart from COVID has to be addressed, because if you don't address that other disease, then COVID is going to give you more trouble. So if you have a UTI, whether it's post-COVID, pre-COVID, no COVID, whatever, that has to be treated. It has to be treated with the appropriate antibiotic, which is based on the sensitivity. Even if it is a nephrotoxic antibiotic only, which is going to work, and all the other antibiotics are not going to be working, even if it's a nephrotoxic antibiotic, please take it, but you have to adjust the dose, which your nephrologist will be able to guide you about, and adjust the dose and monitor the kidney function. Because if you don't treat the urinary infection because of fear that either COVID or the antibiotic will create trouble, then the infection will get worse. It will go into your bloodstream. You might get a very serious situation like sepsis. So you must treat whatever problems that you have. And even if it is nephrotoxic medications, please go ahead, because if you don't, your kidney is anyway going to get into trouble because of the infection.
All right. Thank you so much, Doctor, for this wonderful session. So I would now want a top tip from you. How do I take care of my kidneys during COVID-19? Top tips from you.
If I can say it in 3 words, do not panic. Because COVID, we have been, as medical personnel, we have been through so many of these so-called dangerous viral infections. We have had SARS, we have had AIDS, we had Zika, we're having now COVID. We have been through all of them. At the end of the day, don't let COVID infection overrule your life. Whether you have COVID or not, the standard care that you need to take for your underlying diseases, whether it's diabetes, blood pressure, heart disease, kidney disease, will remain the same. And most importantly, ensure you get the vaccine. And there is no contraindication to the vaccine. So anybody, whatever level of kidney disease you have, whether you have chronic kidney disease, or you're a dialysis patient, or you're a post-transplant patient, the COVID vaccine is indicated, because the COVID infection is much, much more dangerous than the vaccine. And if you take the vaccine, there is a very high chance that you will be protected from COVID infection. Even if you're not protected from the infection, even if you get the infection post-vaccine, the intensity of COVID infection will be much less. The chances of hospitalization and ICU will be much less. The chances of requirement of oxygen will be much less. The chances of you surviving the COVID infections will be much higher. So to just put it in one line, do not panic. Continue whatever treatment you're taking. Ensure your diet, your fluid intake, your weight, your exercise schedule, your medications are going on regularly. Ensure your dialysis sessions are going on regularly. If you're a transplant patient, ensure your immunosuppression is going on at the correct dose and the standard dosing. Monitor your kidney function properly and follow the 3 precautions of SMS, avoid crowds, and finally, last but not least, ensure you get the vaccine, and any brand of vaccine is fine, and ensure you get 2 doses of the vaccine. 1 dose will not be enough. So thank you all very much. Have a wonderful weekend and have a safe year, and we can all beat COVID together. Just be positive and we can do it. Have a wonderful day.
As usual, it's always lovely and very ensuring to have you, Doctor. Thank you so much for spreading so much of positivity again. Thank you.
Thank you very much. Have a wonderful day, Jansi. Bye.
Thank you. And my dear audience, here comes your chance of winning prizes from Apollo 24/7. Here are 3 questions that I'm going to ask you. Type the answers in the chat box, and I'm going to select the winners, and I'll announce the name of the winners towards the end of the show. And you have to write back to us with your contact details to claim your gift vouchers to marketing@apollo247.com. Get ready. Your question number 1 for today is, when is World Kidney Day celebrated? Question number 1. When is World Kidney Day celebrated? Question number 2 coming up. What is the full form of CKD? CKD. बहुत बात किया है आज हमने ये शो पे. CKD क्या होता है? Full form type कीजिए. And the third question and the last question for today is, which option on the Apollo 24/7 app allows you to book COVID vaccination slot for yourself and for your family members? Which is the option on the Apollo 24/7 app which allows you to book COVID vaccination slot for yourself and for others? बहुत ही सिंपल है. इसके बारे में भी हमने बात किया है. कहाँ पर है वो आप ऐप पे देख लीजिए और टाइप कीजिए, send me the answers. And while the answers are coming in, while we are selecting the winners, let me tell you that Apollo is now offering you a COVID care package during COVID and beyond COVID. here's Apollo 24/7, which is making your recovery faster and easier. COVID care package comes in 3 doctor consultations within 1 month. That is 30 days. You can access the doctors with each appointment. 7 days of chat access is given. And all this is coming only at 599 rupees, which is a reduced price right now. To avail these services, you can scan the barcode or the QR code which is given on the screen, or there's a link which we will provide you in the chat box through which you can avail COVID care package as well. Thank you all so much for participating and asking these questions. And these questions are very important because a lot of participants, a lot of viewers who are watching the show are benefited from these. And while I'm waiting for my winners, I'm going to announce the gift coupons. Use coupon HH247 to get up to 199 rupees off on online consultation with Apollo doctors. You can use the coupon HH247 to get 15% off on medicine orders as well. To use these coupons, you have to log on to Apollo 24/7 app, and that's a very simple way that you can use. And if you're not a Circle member yet, you can become a Circle member to get the benefits of Circle membership. Now let's see who the winners are. One is Karthik Surendra. Question number 2, the winner is Venkat. And question number 3, I have not yet got the answer, so we're not announcing the winner this week. Thank you all for joining us today, and we shall see you in the next episode. All right, we've got the 3rd winner. It is Sri Parna Sarkar. Congratulations to all the winners. Please do write back and claim your gifts. Thank you all once again joining us. Do send your feedback, and we shall see you in the next episode of a Health Hour. Namaste.